It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network featuring some of the best physicians in the Dallas-Fort Worth area that help change people's lives.
Right indeed, Candace. This is the place to come to find the right doctor, because these are the doctors that are helping change people's lives, as Candace said, like our first doctor, orthopedic spine surgeon, Dr. Robert Myles.
A disc replacement is a newer method of treating neck pain and disc herniations. Also helps deal with disc disease in the cervical spine. What the disc replacement does in this situation is instead of a solid fusion, you still have motion between the vertebral bodies.
Well, I had numerous injuries, and I'm not really sure exactly what injury it was that started this, but about 5 years ago is when I started having a lot of arm pain that was inhibiting me from performing my job duties.
90% of the people that have a herniated disc don't need a surgery. Generally, the pain goes away with just using some type of non-surgical treatment. The people that might need a disc replacement are the patients that have had that treatment and they haven't gotten better. In that situation, if they have one-level disease, we like to use a disc replacement mainly in one-level disease. We take out the disc and replace the real disc with an artificial disc.
I've worked with Dr. Myles now for 11 years as his physician assistant, and I see patients come in and out with back and neck pain every day. And just as the professional didn't pick up that I was having the same symptoms that my patients have on a daily basis, I was thinking that it was just my shoulder and my arm. And then once Dr. Myles did the exam, I had a lot of physical findings, and we decided that it was my neck, so we went ahead and proceeded with the MRI at that time.
All patients aren't a candidate for a disc replacement. However, the ones that might be candidates would be people that have neck pain and or arm pain. If they have degenerative disease in the neck and it's localized to 1 or 2 levels, they can be a candidate for a disc replacement. And what happens is if you notice, once I put this on here like this allows the vertebral bodies to continue moving.
After surgery, I had pain freedom immediately down my right arm. I no longer had any pain. My pain was a 0 out of 10 compared to before surgery, which it was get up to a 10 out of 10.
PAMA's mission is pain freedom, and as a spine surgeon, people come to me with pain. And together, I think myself and PAMA have the same mission, and that is to make people's pain better.
Professional hockey player Craig Bernard shattered his wrist, but now he's back on the ice thanks to Dr. Stephen Traum. To hear more about Craig's story and other life-changing stories, log on to bestdocsnetwork.com.
Babies with cleft lip and palate are born every year. The incidence is about 1 in 700. So while it's not very common, most people probably know somebody who may know somebody who had a cleft.
When we got our referral approved from the Chinese government, it said that we were going to get a child with bilateral cleft lip and palate. We took our referral picture to Dr. Hall and asked him if he could fix her. And he said, I'd be happy to. And I was thrilled. It was a huge sign of relief that he was going to be there for us.
Andrea's a delightful child. She came to me after being adopted from China. She had a bilateral cleft lip and palate, so that was a little bit more severe deformity than you might find with a one-sided lip or just an isolated cleft palate. But she had some work done in an initial repair in China. Clearly, a very rudimentary repair had been done, and she didn't have the full treatment plan completed.
I've heard that the average cleft child has 8 surgeries, and she will be average. She's had 7 so far.
The treatment plan for these patients starts at very early age. A lot of specialists are required to help take care of these babies in the proper way. It's not just the plastic surgeon who's going to be doing the repair, but you need speech pathologists, orthodontists, dentists, as well as ENT surgeons. And together, you come up with a comprehensive approach and a treatment plan. So I performed a lip and nasal revision, as well as fixed the remaining hole in her palate, as well as did a procedure for her to improve her speech.
Her next procedure will be when she's around 16. Well, they'll move the upper jaw forward and do maybe a rhinoplasty as well.
She had initially had some language transitional issues, but quickly learned English, and she is very well integrated and just a happy child at school.
She looks fabulous, and she's a resilient child. She's always happy, and she loves the way she looks. And Dr. Hall has really changed her life.
I love Dr. Hall.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
And now let's meet our next doctor who's changing people's lives. It's General Surgeon Dr. Philip Swanson.
When somebody comes in and they are interested in weight loss surgery, there are basically 3 types of surgery that we do.
It takes longer to lose weight, 3 to 4 years according to Dr. Swanson, unlike the sleeve.
The advantage of the sleeve is that when you remove part of the stomach, you change the communication of your insides. Their stomach and their brain and their fatty tissue communicates and says, you need to live at 300. When you change that communication, on the day of surgery, their brain now thinks you should weigh 160.
So that is one big advantage of the sleeve, just like the bypass.
Because we physically divide part of the stomach away so that it no longer is in contact with the stream of food. So we know that if you stop food from contacting the very first part of the intestine, the duodenum or duodenum, that diabetes is dramatically improved. Diabetes is a horrible disease. And if you can cure that, that's why I do this. I want these people to be well. I want them to be healthy. I want them to be happy and live long. That's why I do this.
You hear a lot about low testosterone nowadays. Don't respond to a lot of these things you hear on the radio or on TV or on ads in the newspaper. A lot of it is just a way to produce revenue. Low testosterone is more common than we thought, and it's easy to measure in your doctor's office. And low testosterone can occur as you grow older, or it can occur in young men. What are the symptoms? Well, you can feel tired, your muscle mass may be low, or you may not be able to build muscle mass with exercise as you once were able to. One of the main symptoms is a low libido. Your sex drive gets low. Your interest in sex is not quite what it used to be. If you have those symptoms, you can get your testosterone checked. Testosterone tends to go up and down during the day, so you have to have 2 or 3 points in time, and that means 2 or 3 different blood tests to find out what the average is. The most accurate time to have your testosterone level drawn is 8 to 10 a.m. in the morning. That's when we know exactly what the measure should be. And if you're low, and the other hormones that we check along with it, if they're also low, then going on testosterone replacement will help you. It'll improve your libido, it'll improve your sense of well-being, your muscle mass, and your energy. So check it out, but do it in the right place, your doctor's office.
I was a veteran in the United States Marine Corps for 4 years, did 2 tours overseas, and I went to the VA because I had been having recurring panic attacks and tried to take a route through private insurance and doctors and everything, and nobody really saw me as somebody who might potentially have issues. Like, I think I might need something like this since I've tried all these medications and it haven't worked. They were like, oh, this kid's just a pill popper. Long story short, it was just like a bad confluence of events, and between a bunch of stuff happening, I was like, I need to talk to somebody about what's going on, so that's why I came here. Specifically, I came to Germany because I wanted somebody who was a veteran and had that background and could identify with me on that level.
I see a wide range of clients, but primarily I focus on veterans, active duty, military personnel, their families, friends and loved ones, basically veterans and anybody that comes into contact with them that could use a better understanding of what they're going through. And also I see a lot of chemical dependency issues also, and oftentimes those co-occur in this population.
Pretty quickly, within like the first 10 minutes, we were able to move right into what was bothering me, and over like the span of 3 months, I felt like I had gotten everything out of it that I needed to, and within a month I was feeling better. You don't want it to be some long drawn out thing for a year or several months. It was like that.
I've been in the service. I served for 8 years, and so how I found that is helpful for me in my practice is that I speak the language. I'm able to communicate with them on a level. There's a lot of understanding that goes on and a lot of freedom from having to explain certain things that may not make sense to someone who hasn't been in the military. And so oftentimes that bridges a gap that can be pretty wide when a service member or a veteran is seeking out therapy for his or her issues.
I'm really, really pleased with my experience at LifeWorks Group and with Germany Landing. It's been outstanding. There's a lot of people on staff that are trained to deal with this, who do have personal experiences with this. And I was able to feel really comfortable, really able to connect with somebody, as not just somebody who understands, but somebody who's actually been there. I'm just a lot more comfortable with how everything's going and just thinking things more positively now.
Jacob's quality of life was affected due to gastric reflux disease until he met Dr. Glenn Eide. To find out more about Jacob's story and other life-changing stories, log on to beststocksnetwork.com.
The procedures that I have been doing for a number of years that involve endoscopic approach are done on what's commonly called a neuroma, which is a swollen tender nerve up in the ball of the foot. It's very, very difficult to walk on at times. It's very painful.
I started having foot trouble probably in '04 and went to doctors and had several diagnosed with Martin's neuroma. It's a sharp pain up in the ball of your feet. It was on both of them, and at various times it was difference in pain. Sometimes it'd subside, sometimes it'd just be where you couldn't stand it.
We discussed with him the traditional approaches to these procedures. After a discussion with him, we did decide that since his conservative measures had failed, we chose as a team to do an endoscopic procedure.
I had surgery in May. Dr. Singleton did my right foot. I hadn't had a whole lot of pain in my right foot. I think it still needs to heal just a little bit, but it's pretty much pain-free. And then we just did my left foot last Thursday. And of course, it's definitely in the healing process. And I would not have had my left one done had my right one hadn't been successful.
After his procedures, he has told me that his pain has been resolving substantially and he can start to walk and feel a whole lot of improvement.
He's a good guy. He doesn't beat around the bush. He tells you how it is.
His life has improved. His work has improved. He's not as fatigued because of the pain. And I think that with a little bit more time and healing, he should do very, very well. As a PAMA physician, it's been one of my goals to provide pain freedom for various foot conditions, and it's been a very fulfilling part of my life.
Dr. Singleton, he's given me the pain freedom to do the things that I have normally enjoyed doing and hadn't been able to do in a while. You know, I hunt and fish a lot, which that's going to help me out there because I hadn't been able to do that either. I'm very thankful for him and his procedures and this clinic for getting me to where I'm going to be able to do that.
Of course, don't forget, for more information on any of the great doctors you see on today's program, head to the website bestdocsnetwork.com. That's bestdocsnetwork.com. And Candace, let's head up to our next best doctor.
That's right. Next, we're going to meet Dr. Cesar Duclair, who's a pain management specialist.
I had gone through 2 major back surgeries. I have a lot of bolts and screws and nuts and squirrel cages and fusions in my back. I have had a terrible time with all of the pain I experience in my everyday living. I lived on pain pills and my quality of life was awful. I wasn't the guy I wanted to be for my family, for myself, so I needed another way of life.
Greg is a prototypical guy. He hurt his back doing some heavy lifting. He ended up having a spine surgery, and he ended up having a second surgery. And when he came to me, he was very disappointed with the results of his surgery. He was almost at the end of his proverbial rope, feeling that there was nothing for him.
He said I was pretty screwed up. He said my back was quite a mess. He went back to the original x-rays and took me through this, and I went through a lot of spinal injections. He had recommended we did those, and they gave me some temporary relief, as he said they would. The pain would come back, and so we got into the next phases of doing the spinal cord stimulator.
That is an electrical device that is implanted in the spinal canal next to the nerve roots that are causing their pain. It produces a sensation of pressure or tingling in the areas that they typically have pain. The brain actually pays attention to that pressure, that tingling sensation, more than it does the pain. So they actually don't feel as much pain, or sometimes no pain at all, from those typical areas.
I take and I turn it up, and I put it on, and I turn up the volume, and I sit for 5 minutes or 10 minutes. That's better than taking the pain pill because I can manage my pain much better. I really do have pain freedom when it comes to working with the operations. And I'm very, very pleased with where I'm headed.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
People who are out there and having lots of recurrent respiratory infections may not realize it, but the kind of doctor that they really need to see is an allergist immunologist. Because when a person's having recurrent sinus infections, there could be 3 major reasons why they might be having them. 25% of people in America have some form of allergy, and a lot of those people get recurrent sinus infections.
Prior to coming to Dr. Baxter, I tried several other things, but really I was doing self-medication, just pretty much living with what I was having to put up with, thinking this is just the way it is and I just have to deal with it.
What basically happens is that the membranes inside the nose become so swollen from infections that secretions are trapped there and infections can't drain, and the area just stays chronically infected.
What I was doing was I was alternating between Dr. Baxter and the ear, nose, and throat doctor to get my antibiotic.
His allergies were causing the frequent infections that he was having. and he's really not having those anymore now that he's taking his shots, and his shots have been able to be built up to a high dose.
And so Dr. Baxter took the approach of let's fix the problem instead of masking over the result.
25% of people in America have some form of allergy, and a lot of those people get recurrent sinus infections. 10% of people in America have chronic sinus disease based on a structural issue, meaning their anatomy requires a fix by a surgeon. And then about 1% of people in this country have an immunology reason why they are having recurrent infections. And so basically people, when they're having chronic infections, if they're not sure which doctor to go to, they really should think about going to their local allergist or immunologist.
Dr. Baxter helped solve the problem by getting to the root of the problem. I recommend to my friends all the time, I say, you know, if you have a cold or an allergy or something, go see Dr. Baxter. She helped me get over my particular problem.
The Best Docs Network is all about doctors helping change people's lives, like our next doctor, Mohs surgeon, Dr. Patrick Walsh.
Mohs surgery is a surgical technique for the removal of skin cancer that enables us to examine all of the surgical margins of the tissue that we're removed so that we're sure that we've gotten all of the skin cancer. It has the highest cure rates of any technique of treating skin cancer and enables us to preserve as much normal tissue as possible while still removing all of the skin cancer. The technique is very much like the biopsy in that everything is done in the office. We just use a little local anesthetic, numb the area up, and remove the area that we can see. The way in which it differs from the biopsy is that we take the tissue that we excise and prepare it in our lab. We make our own slides, and I examine the slides under a microscope to determine if we've gotten all of the skin cancer. If we have, we stop there. If we haven't, we know precisely where any residual skin cancer is. We go back just to that area, remove a little bit more tissue, make some more slides, and keep repeating that process until we're sure we've gotten all of the cancer. If the skin cancer is very small and very superficial, the wound that results from the surgery that we do may be very similar to the wound they had after the biopsy. Very often it will heal satisfactorily on its own with good routine wound care. However, if the skin cancer has invaded more deeply or is wider than what it appears to be on initial exam, then we may recommend a repair of some sort. And they range all the way from simple side-to-side closure to a skin flap or a skin graft. And as with all cancer, early detection and treatment is the best way to cure skin cancer.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Atopic dermatitis, often sort of synonymously referred to as eczema, even though a lot of people think eczema can be other things than atopic dermatitis. Most patients and lay people think of it as the same disease. Just sort of think of it as your skin is just too sensitive to the everyday things in the world that most normal people can tolerate without any problem. For example, when the air gets really dry, a lot of patients that have atopic dermatitis will start to break out, their skin will get itchy, they start scratching, then they get more of a rash. And in fact, a lot of people have actually referred to atopic dermatitis as the itch that rashes. People itch first and they start scratching, their skin gets irritated, they get this red oozing, and then they end up getting secondary bacterial infections with staph and other things like that that really makes it get much worse. If someone's got atopic dermatitis or eczema, for example, they need to be treated with something to prevent it from getting worse. And some of the things we use are things like moisturizers and emollients. We want to try to, if there's any secondary bacterial infections, driving condition, we want to get rid of those by using antibacterial washes. Bleach washes are very good for that, and we now have the clean body wash that works very well because that can be used both in the bath as well as in the shower. You'll also need to use antibiotics, sometimes hopefully topical, but in some cases it may have to be oral antibiotics. And then even other ancillary things we use are ultraviolet light treatments, antihistamines, topical anti-itch preparations, even in some cases anti-rejection drugs like cyclosporin have to be used in really bad cases. Most cases do begin in childhood, but there are some cases, rarely, that actually begin in adulthood. The good news about atopic dermatitis is that if you develop as a child, there's a fair chance that as you get into your teenage years and a little bit older that you'll outgrow it. You may still have a tendency to have some allergies and hay fever and that sort of thing throughout your life, but in a lot of cases the atopic dermatitis gets much better in the teenage years and in the 20s. It's also not contagious. It's not something you can spread the disease from one person to another. Now, one of the problem is, though, if a child is contaminated and carrying staph, that can be spread within households. It's very important that if a child is infected that they're taken care of and you try to limit that so that the parents don't get it or the other siblings don't get it, because that can be a problem.
Mike, a loving father of two, was in severe back pain until he met PAMA physician Dr. A.L. Shaw. To find out more about Mike's story and other life-changing stories, log on to bestdocsnetwork.com.
Prosthodontics is the name of the specialty, and it's one of 9 dental specialties recognized by the American Dental Association. It's a specialty that requires 3 years of additional training at a dental school level. It's 3 years dedicated to the specialty of prosthodontics, which is reconstructive dentistry, including dental implants, crowns and bridges, dentures and partials, some TMJ treatment, and other small areas of dental reconstruction that most people will never need. A typical patient that finds our practice has needs ranging from fillings all the way up to full mouth reconstruction. We handle everything in-house. By having everything in-house, we have total control of patient outcomes, and that's our main goal here, is to have fantastic outcomes. One of the biggest strengths of my practice is the amount of time we spend with each patient. It's all about education here. Every new patient is scheduled for 1 hour, and we go through their complete diagnosis, their treatment plan, and we attempt to educate them on all the options that are available. And it's one of the things that I enjoy the most about my practice, is getting to know the patient and helping them understand their problems, but also giving them several different options on how to fix their problems. We often have multiple try-ins so that we don't just make the patient look good, but we make them look fantastic because we've taken the time to pick the right tooth size, tooth shape, and tooth color that fits their complexion and their facial shape. Another way that my practice significantly departs from common implant treatment is that I do everything myself. I do the planning, I do the surgery, I do the teeth. It's all me and my hands fabricating these restorations for the patient. There's not a laboratory technician that comes in during the procedure, and no one else touches the patient's care except me. We're committed to patients having long-term success, so we do provide all phases of services, including cleanings and maintenance. Often I frustrate my patients because I'm so picky about their outcome that we sometimes have to make changes or we have to redo the restoration if I'm not satisfied with it. But it's important to me that we get it just right for every patient, whether it takes extra time or not.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that, of course, are changing people's lives.
Yes, and if you want more information on any of these great doctors, Candace, where do the people find them?
To our website, bestdocsnetwork.com.
And if you have a question or comment for us, we'd love to hear from you. It's info@bestdocsnetwork.com. Coming up next, don't miss it. It's Best Docs Network featuring Forest Park Medical Center, one of the top medical centers in the entire Dallas-Fort Worth area.
And that'll do it. That wraps up another edition of the Best Docs Network. Have a great day.